Okay, thanks for having me again. I was in one of the panel sessions just now, and now I'm talking about design for safety. This topic is based on two of our papers in my research team, and we are collecting data from Singapore across since the time that the design for safety regulation have been implemented, and we derive some of these findings from our research, from our data. Okay, so in terms of the topic, a lot of time when we talk about design for safety, we think about the designers coming together and they are discussing about how to improve the design so that it's safer downstream. In the local terminology, we call it design for safety, but in other countries, in UK, they will call it CDM, construction design management. For example, US is prevention through design. So there are different terminology. In Australia, is safety and design, etc. But locally, we use the term design for safety. So today I'll touch on just very briefly on the importance of design for safety, which is already covered in the earlier discussion in the morning about elimination of the need to work at height, for example, so that you don't have to deal with some of these issues downstream in terms of behavior of workers. I will talk about the different types of cultural norms that are seen in our local context, which you think are also applicable to other countries. And we'll talk about a tool that we developed in our research team on how to measure design for safety culture. I think this is something that have been discussed in the industry and in the literature for a long time. So I don't have to repeat this, but just to highlight it so they have the same reference point. I think this started in Europe and specifically in the UK. There have been studies highlighting the importance of design in terms of safety and health. Many a times, the people at the front line can't really change some of the physical situations because the design had already been fixed. Right? Workers need to build something that's really difficult to construct, unsafe to construct, and they are stuck in that situation. And that's why, based on some of the data here, 63% of the fatalities and injuries in the UK, that was quite some time ago, were traceable to design decisions or lack of planning. This is from Europe also, roughly in the same range of data. And in the US, Professor Michael Bim, a good friend, also did some research work in terms of the importance of design, in terms of safety and health. So design for safety, there are different ways to look at it. Generally speaking, it can be seen as a process, but of course there's a mindset portion to it. But broadly, you are trying to get the different stakeholders together upstream when it's less costly to make changes so that you can implement safety measures earlier so that you can eliminate some of those hazards inherent in the design. And the earlier you do it, the less costly, the more feasible it is. But of course, in the real world, there are different challenges. But broadly, it is something that a process to pull the different stakeholders together to look into how to ensure safety downstream. And there are different stakeholders. There's the developers, the designers, and of course, the contractors. Here, I'm looking at the construction industry. We are more locally, the design for safety regime is focused on the construction industry, but the same concept will apply to any industry actually. But let's focus on our context in terms of having the developers, the designers, and the contractors. All of them play very important roles, and it is important to get all these stakeholders involved in design for safety. At the same time, a lot of time when we just look at the processes is not enough. As highlighted in the earlier presentation, culture is really important. But the problem with design for safety is that rather than just looking at the workers that you can see and interact with on a day-to-day basis, you are designing something downstream for people that you have not been in touch with. The designers they have to imagine, okay, who are these people? How are they going to work? And what are the hazards they're going to face? And the designers may not be familiar. And that's why the mindset in terms of placing importance on safety downstream is so important. And that's where culture comes in. If you just look at it as a process that you need to go through, many other times people will just do it for the sake of doing it, and you wouldn't see good results. And that's where organizational culture comes in. Organizational culture, there are many aspects to it. Is essentially about the shared values and beliefs across people, and they interact with the different stakeholders, the people, the control systems, the management systems that you have, and the organizational structure. And that produce certain behavioral norm in the organization. And that when you apply to safety culture, it is in the context of safety-related behaviors and the norms that you have in relation to the culture, in relation to the different stakeholders, the people, the control systems, and the organizational structure. So if you try to apply this to design for safety, it doesn't click as well. There are certain issues with that, and we studied this problem of applying safety culture concepts in the context of design for safety. And we published 2 papers, one in the Journal of Management in Engineering, the other one in Journal of Risk Research. So the first paper was published in 2025. The second was published in 2023. So I'll take you through very briefly in terms of the content of these 2 papers, where we try to understand culture in the context of design for safety. This is not meant to be read, it's meant to tell you that we have data, okay? So essentially we have 59 semi-structured interviews, which is considered large for qualitative research. And we talk to consultants, design for safety professionals, main contractors, developers, designers, regulators, project managers, and engineers. So based on this relatively large set of data, we have derived a model. So this is a model that is based on Dr. Hu Xiaowen's work on in terms of safety compliance. She was looking at 2 contexts, two variables, one on intent, 2 on effort in terms of compliance. So in terms of compliance, there are these two aspects were based on hers work in I think 2015 or earlier, I can't remember. So it was more focused on individuals. So in our context, we are trying to apply to organization and in the context of design for safety. So what we found is that based on this 2-axis model, the y-axis is on whether the focus is really to fulfill the intent of the regulation. So in terms of design for safety, the intent is really to reduce design risks in design so that downstream stakeholders do not need to face these risks. So that's the y-axis. On the higher end, you have where the stakeholder, when they're doing design for safety, they are really focused on this intent of reducing design risk. On the lower part of this matrix is really to avoid penalties. So it's really purely for compliance. So that's the y-axis. And then the x-axis on your right is really deploying the amount of effort that people put in, right? So on the right is about deploying significant effort. And then to the left is deploying minimal effort. So the x-axis is about the amount of effort, and the y-axis is whether the intent is really to fulfill the spirit of the law. So as a whole, based on this, we found 5 groups of people with different types of behavioral norm in the construction industry locally. The first group are the people who are, well, in the ideal type of state in terms of design for safety. They are really, in terms of deep compliance, they have deep compliance to the regulation. They do things really to fulfill the spirit of the design for safety regime. They really want to minimize the risk. It's quite rare to find organizations in this box, unfortunately. They put in a lot of effort. They really spend a lot of time discussing how to minimize the risk downstream putting in measures to eliminate some of this work at height risks or other types of risks. And they get multiple stakeholders involved, and they iterate through the process and really take up a significant amount of resources. So there's one group, deep compliance group, which is the dream group, right, in terms from a safety and health point of view. And then the other group that we met, they are pretty serious about design for safety. We call them the alternative deep compliance group. They really want to meet the intent of the regulation, but at the same time, they have plenty of resource constraint, and they try to minimize the effort. A lot of time, they'll integrate the design for safety type of processes into their existing processes and try to include the considerations as part of the design review meetings, for example. But at the same time, they have very limited resources, but they try their best within their constraints. The third group is what we call the enlightened surface compliance group. They do have the intent to fulfill the intent of the regulation. They do try their best to do that, but they try not to spend too much effort. They try to balance it. And leadership ensures attendance. They actually have a lot of compliance-related documents done, but they are not as diligent as the group that we've seen in the deep compliance. They try to find a balance. They do have enough resources to do something, but it's somewhere in between. So these three groups are still on the positive side of things. They are relatively forward-looking. They are pretty serious about design for safety, but they range in terms of the amount of effort that they put in to really improve design for safety. Then there's another group that we found that's called what we call the extravagant surface compliance. So surface compliance means that they just do things at the surface with the intent to just meet the to prevent penalties, to just meet the documents needs to display to the regulators that they have done their part, but they put in a lot of effort on that. So they spend a lot of money to get consultants to protect themselves. They spend a significant amount of effort to run through meetings, but their key concern is always about compliance. They always talk about, are we going to get into trouble? What would the regulators look for when, if you do this or do that, will we get into trouble? So their key concern is still about complying with the law and not really to reduce design risks. And the last group is the surface compliance group. They are not really keen to spend too much effort. They are just trying to do their part to the minimum, to minimize the effort. They don't really understand the intent of the DfS regulation. They are always confused about the usual risk assessment and the design for safety review. So these 5 groups stood out as we look at the interviews that we have conducted. And the different groups have their own constraints. They face different challenges as they work through their system in terms of implementing the design for safety review process. What we found is that many of the factors that influence are things like resource availability, the organizational priorities in terms of how much emphasis they place on design for safety, the regulatory strength in terms of their perception of how strong the regulators are going to enforce on this regulation. So these are a wide range of organizational factors that influence their behavior, the organizational culture in terms of design for safety. So these different groups show us that under the same regime in terms of design for safety in the local context, there's a wide range of different reactions in terms of how they cope with this mandatory regime. And it's one of the key things at the end that we want to emphasize on is it still comes back to culture. This is still the main basis because there are so many different ways to cope with a regulation. They can easily show how they are complying with the regulation without doing too much, right? Because the number of inspectors is limited. The number of inspectors focusing on design for safety is even more limited. So the chances of them being caught is pretty low. So a lot of time we need to encourage them to think about how their work can actually help them in promoting their organizational culture in terms of improving their work in a holistic fashion. So that's why in terms of encouraging these organizations, one of the starting point is to measure how well they're performing in terms of their design for safety culture. The concept of safety culture has been discussed in the literature, in the industry for a long time. It's not something unique anymore. But if you apply it to design for safety, it's different because of the way that we measure it, right? It's a very different context. The kind of artifacts in terms of the outer layer. In any culture, there are 3 layers. The outer layer are things that you can observe. In a construction site, if you go down, you look at the housekeeping, you get a sense of how well the site is being upkept, how serious people are is in terms of safety and health. You look at how the workers behave, you get a sense of how things are moving, what is the culture like. And then there's the middle layer, which is essentially about the espoused values. People talk about how they see the safety culture being implemented in terms of the policies, in terms of the procedures, how serious people are about all these different processes in the organization. So they talk about it, they tell you how they view all these processes and whether they are taken seriously. So that perception is captured as safety climate, and that's a term used in the literature. The core layer are the basic assumptions that people hold about safety and health as a whole. So these 3 layers is almost impossible to measure the core assumptions. It's very difficult. Sometimes you can talk about it, and that will become the middle layer. You can only observe how people behave, and you can try to infer what's the core layer about in terms of their safety culture. So most people use a questionnaire approach to measure the safety climate, which is essentially about the middle layer. And we define design for safety climate as the shared perception of and the meaning attached to the DfS policies, practices, and procedures project team members' experience and the behaviors observed getting rewarded. And essentially, this is about perception. Okay, perception of project team about how serious the organization is about design for safety. And it's different from the typical safety climate because of the groups that they belong to. Many a times when we measure safety climate, we are looking at workers, the supervisors on the ground. But in design for safety, we are not looking at the frontline people in that sense. We are looking at engineers, we are looking at architects, we are looking at the developers who are paying for the design. So these are upstream people. So the items used in questionnaire need to be different. And who are the people affected? So when you talk to workers, they are the people who are directly affected when we try to measure safety climate. But if you look at design for safety, you're talking to engineers who are designing things, but they are not the people directly affected. And of course, the target is about, there are differences in terms of safety climate. It's about safety processes on the ground, but design for safety is during the design process. And the outcome is, for the safety climate, is about safety behavior of frontline people. And the outcome that we look at in design for safety climate is a reduction in the risk inherent in the design. So essentially, we're looking at design risk. To develop this tool, we reach out to 2,000 over participants for such surveys. The response rate typically is about 5 to 10%. So we got about 200 over respondents. And we identified 5 key areas in terms of measurement. So when we are trying to measure design for safety climate, we have to look at the participation of the leaders of the project resources assigned for design for safety, the expectations for stakeholder representation, so the expectations set on all these different stakeholders, and how the members are performing in terms of the design for safety roles, And lastly, in terms of member cooperation. So once you can start to measure the DfS climate, it's the same as in safety climate. That's why you start to have a leading indicator that you can use to understand how well the project is behaving in terms of design for safety. So it becomes a leading indicator. And that will help us to track whether things are improving. And it's important to keep track of the changes across time. And you can use that to do your gap analysis using the usual radar graph. And you can look at what are the target level, and you can measure them and see where are the discrepancies, and you can handle and focus on those areas that require improvements. And in our study, we found that in terms of design for safety climate, one of the core components at the end is member cooperation. This is not about site personnel coming together, but more about the engineers, the architects, the designers, the project team members, the project managers, working as a team to look into design as a whole. So whether they are cooperating, and that is a key determinant of how well design for safety can be implemented. So this is one key variable. If you are trying to improve your design for safety climate, this is definitely one of the key starting points. And the benefit of focusing on this is very wide-ranging. It's not just on safety-related issues, but on the design as a whole. So the project will benefit by focusing on the member cooperation. So what I covered is very quickly on design for safety. Now, in terms of our research, we found that, of course, design for safety is a very important aspect. To get it to work, the organizational culture is a very important key element in terms of providing the foundation for its success. In our study, we found that under the same DfS regime, there are different responses from different organizations. From those who are very enlightened, they are very serious about design for safety, putting in a lot of effort and trying to implement and achieve the intent of the regulation, to the other extreme where they are just trying to do the minimum and just trying not to be caught. And to help them improve in terms of their design for safety climate, we came up with a tool highlighting 5 key elements to help measure the design for safety climate. And we found that the key element is still coming back to teamwork in terms of member cooperation. If you're interested in some of our work, you can drop me an email. I'm happy to share the instrument that we developed with you. With that, I still have about 6 minutes. I'm happy to take any questions. Yes. Maybe it's good to give him a mic. Yep.
Kia ora. Through your research, did you find any stakeholders who were executing design for health? So are we heavily indexed towards safety because there's a clear and present risk? There's a very clear mandate and willingness from a regulator. In New Zealand, for every 1 person we kill at work, we usually kill about 13 or 14 related to health. So we're heavily indexed towards safety despite the statistics. Is your research showing anything different?
Okay, just to clarify, in terms of design for safety, it's not purely for the safety aspect only. I think it's out of convenience that it's called design for safety. If it doesn't, the intent is to cover the health aspect also. Fully agree with you that we should not just focus on the safety aspect. I think designers and all stakeholders should also look at both design for safety and health. On the ground, most of what I've seen in terms of the case studies that were collected, most people are still talking about safety issues. Very minimal discussion about the health aspect, but definitely that is a gap that needs to be closed. Fully agree with you. Yeah, more work needs to be done in that aspect. Yeah. Thanks for the question. Any other questions? Yes.
Hello. Hello, good afternoon. Yeah. Actually, the construction risk management have 5 types of risk that include environmental, legal, financial, safety, and the other one is the project. So, what are the difference between DfS and the construction risk management?
Okay, I do teach project management in the university. Yeah, definitely project risk management is something wider, and risk management as a concept is very wide. It can be applied in many different areas in terms of resilience, in terms of project, in terms of organizational risk. So safety and health is one type of risk, right? As you rightly pointed out. Design for safety is really trying to push this risk management process upstream so they start looking at the risk as in a more project lifecycle approach, that you don't just look at the construction phase, you also look into the maintenance, the use of the structure, even the demolition. So the range of risk is across the project lifecycle, but it's still within the area of workplace safety and health. Right? The only key difference is that you're doing these risk management processes upstream earlier when the cost of making changes are lower. So it's not a separate category of risk. It's still under the scope of workplace safety and health. Yeah. Thanks. Thanks for the question. Any other questions? Anyone? Okay, I think I've done my part, and I'll hand back to Kelly. Thank you so much. Thanks, everyone.